जो कि हमें पता है कि टॉक्सिक है और हॉट नोड्यूल भी होगा, हम थायराइड स्कैन क्यों कराएंगे?
सर जो इम्पैल्पेबल रेटिनॉल नोड्यूल है,
जाओ, ठीक है। There may be impalpable nodules. There may be nodules in that diffuse enlargement of goiter जो पैल्पेट नहीं हो रहा। इस साइड पे सॉलिटरी नोड्यूल है, तो इधर हो सकता है कोई हॉट नोड्यूल और भी हो, वो देखने के लिए। To confirm whether this particular solitary thyroid nodule is the only hot nodule, or there are hot nodules on the other lobe as well. So to confirm this, you will advise thyroid scan in solitary thyroid nodule. A scenario: a patient presents with lump in front of the neck in midline, which moves on protrusion of tongue. What is your diagnosis? Thyroglossal cyst. What is treatment of thyroglossal cyst? Cyst trunk operation. So you performed cyst trunk operation and removed that thyroglossal cyst. After 6 months, patient comes for follow-up. She is lethargic, she is sleepy, she is obese, she is hypoactive. What's gone wrong with the patient? Hypothyroidism. Why? Because the development and descent of thyroid gland was arrested in the midline. This thyroglossal cyst may be associated with development of whole gland. It may be associated with arrest of development and no development of thyroid gland. In that case, thyroglossal cyst will be the only thyroid hormone producing tissue in the body. So in that particular case, thyroglossal cyst was the only thyroid tissue in the body producing thyroid hormone, which you can remove that thyroglossal duct by cyst trunk operation, and the patient presented with hypothyroidism. Don't you think we should have checked this patient for thyroid development?
yes.
So what is the way to do that? How can we check? Thyroid scan. So thyroid scan, the next indication is thyroglossal duct, या lingual thyroid even. What next investigation?
Thyroid antibodies,
Thyroid peroxidase antibodies, TPO antibodies. One. दूसरी TSH receptor antibodies. What is diffuse toxic goiter called? Graves' disease. What is pathology of and pathogenesis of Graves' disease?
autoimmune disease है
हाँ?
autoimmune disease
कौन सी antibodies? TSH receptor antibodies. And what does these antibodies do? These antibodies compete with TSH for receptor sites and act as TSH. Advise antibodies only in diffuse toxic goiter. But that too depends on what treatment we are going to carry out. If we are going to perform total thyroidectomy, we need not to do antibody test. And for a thyroid function test and neck ultrasound, you have diagnosed that this is toxic multinodular goiter and extending from this area to this area. What else you can do in addition to that? Because you can suspect that a large goiter can deviate trachea and compress trachea, and shortness of breath may be deviation or compression of trachea. For that, which investigation you will advise?
X-ray,
X-ray neck, AP and lateral. Lateral view में आप देखेंगे trachea has become a slit by compression, ठीक है? And PA view या AP view में आप क्या देखेंगे? tracheal deviation. One lobe has pushed the trachea towards the other side of the neck. What else? But now you have to assess patient's fitness for surgery and to rule out other disorders and comorbidities like anemia, etc. For that, what will you do? Blood complete picture, chest X-ray, ECG, blood sugar levels, hepatitis serology, COVID-19 testing. So these are investigations to assess the patient's general health. एक मेडिकल लीगल एस्पेक्ट है इन्वेस्टिगेशन का, आपने प्री ऑपरेटिवली कंफर्म करना है कि इस पेशेंट की वोकल कॉर्ड्स नॉर्मल है, रिकरेंट लेरिंजियल नर्व्स इंटैक्ट है या नहीं. हाउ कैन यू डू दैट? लेरिंगोस्कोपी. कौन सी वाली? एक तो इनडायरेक्ट लेरिंगोस्कोपी होती है, एक फाइबर ऑप्टिक लेरिंगोस्कोपी होती है. ठीक है. सो आप FOL का फाइबर ऑप्टिक लेरिंगोस्कोपी करा के वोकल कॉर्ड्स की मूवमेंट्स को डॉक्यूमेंट कर लें. क्यों कर लें? इसलिए कि सम परसेंट ऑफ पेशेंट्स में ऑलरेडी सब क्लिनिकल वीकनेस ऑफ रिकरेंट लेरिंजियल नर्व and weakness of movements of vocal cords. So आप सर्जरी करें और वो movements exaggerate, वो जो weakness है वो exaggerate हो जाए तो patient can sue you because you have disrupted the recurrent laryngeal nerves and caused him hoarseness of voice. So for that medical legal reason you carry out fiber optic laryngoscopy. हो गया इन्वेस्टिगेशंस. बाकी की इन्वेस्टिगेशन होगी पेशेंट की जनरल फिटनेस के देखने के लिए.